I think one thing is that, just because something has been done a certain way again and again and again doesn't mean that that's actually the best way.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
What's up, Hadar? I've been thinking it's the new year, all kinds of new resolutions. I know you're a big lover of foods. Have you gotten your exercise up, my friend? Any cycling you've been up to?
Oh my gosh, a lot of cycling. I'm cycling around the house. I'm cycling around the kitchen, cycling a lot around the fridge. But I'm trying to make sure that all my cycling is focused on my skin because this year, my friend, is another year of brilliant skin. And I must say, most of my patients that come in don't ask me necessarily about what to do to keep my skin going. They ask me about a disease. But every now and then we get a question, or when you see a patient that's well controlled and they start asking you questions like, so what should I do for my routine? And how can I keep my skin going to look so nice and brilliant like all the dermatologists on TV? What do I do? What do I say? And I got to say, sometimes I'm at loss. I'm not sure what to say.
Well, you know what? When you talked about dermatologists on TV, guess what? We got someone that is not only used to talking to a lot of people, she is an expert. So we have Dr. Whitney Bowe. She is a renowned board-certified dermatologist out at Advanced Dermatology in New York. And I mean, Hadar, I had to recheck these numbers with her when I saw them, but
I know.
1.3 million followers on Instagram. And she talks about skin cycling. It's this concept that she's introduced, and it's gone totally viral. And over 3 billion TikTok views. So,
Did you say billion with a B? Was that a billion with a B? Is that what you said?
Yeah, I know it sounds nuts, right? But I'm so excited that we have experts like Dr. Bowe doing this so that we can actually get credible conversation out there about the skin. Whitney, welcome to the podcast. We are super excited to talk.
Guys, I am so honored to be a guest. First of all, we go way back. I've known both of you for years and have so admired you, so respected your work, your contribution. I've been a listener of the pod, so it is just absolutely such a privilege, such an honor to have been invited to actually be a guest on this episode. So thrilled to be here, guys.
I love it, Whitney. And before we jump into things, I just want to let everybody know Whitney is not only an expert in dermatology, an expert clinician, she's also an entrepreneur, which is so nice that you get to marry this sense of knowledge and expertise with actually building products. So she has a skincare line called Dr. Whitney Bowe Beauty. And just want to, put that out there. So she knows a thing or two about ingredients and a thing or two about skin. So actually, speaking on that, we always like to know who's joining us. And Whitney, can you tell us a little bit about what excites you about, the path that you've chosen and what got you here?
Absolutely. So, I do actually love wearing so many different hats. So, I serve as the medical director for integrative dermatology, aesthetics, and wellness at Advanced Dermatology. And my private practice has actually been fully booked at capacity for close to 8 years now, meaning I haven't been able to take on any new patients during that time. I treat a lot of, faces that you would recognize, a lot of the most famous faces in television, music, fashion. And, I also am a research scientist. So, like you guys, I love contributing to the literature. I've published over 40 scientific publications, book chapters, lectured internationally on my research. And then I also am the go-to dermatologist for Good Morning America, the Tamron Hall Show, The View. So I'm frequently, asked to contribute to TV programs. And I really love social media as well. I feel like it's such a great forum for, some education and, having experts actually be able to get on that platform. There's so many myths, they're so pervasive, as you guys know. And, so it just, being able to represent what our field stands for and, have more of an evidence-based perspective on those channels that a lot of people come to, and they almost use them as like Google, right? They're using it to learn. They're getting their news from social media. They're getting their information from social media. So, I do try to carve out time every week to do that. But yeah, just recently, launched Dr. Whitney Bowe Beauty, which has been, such an exciting wild ride. It's one of the fastest growing clinically proven skincare brands in the market. So I'm able to do a lot of science and research and go full circle with that. I love every aspect of our field. What got me into it? I think probably the thing that really inspired me was when I was 10 years old. I went down with my family on vacation to the Bahamas and I actually got a parasite. I came back, I was very, very sick and I was hospitalized. And the doctors at first didn't know that it was a parasite. They assumed it was, a bacterial infection. So as you can imagine, they treated me with, broad spectrum antibiotic after broad spectrum antibiotic, basically decimated my good flora, my microbiome in my gut. And I got really sick. I got a terrible case of C. diff colitis. And I was in and out of the hospital for the entire year fighting for my life. And I remember one of the residents at the time just sitting by my bed and saying, Whitney, it's trying to explain to my 10-year-old self, like, there's this battle in your body between, the good bugs and the bad bugs. And, we accidentally sort of killed off a lot of the good bugs. And now, we have to regrow those good bugs and bring that back, that healthy balance. And I just remember emerging from that whole experience just with such a profound, passion for like maintaining health, optimizing health, and thinking about, how everything's connected, right? The gut is connected to everything else, the skin gut mind connection. So, as I started practicing, as I started conducting my research, even with the skincare line, I'm always thinking about that very three-dimensional approach, which is really one of the reasons why I think I keep gravitating back to your podcast and your learning tools, because you both have really championed that whole area and really brought it to the forefront in such an evidence-based way.
Well, thank you, Whitney. There's so many angles I want to go about this, and I do want to ask you so many questions. I know that for sure your childhood experience, and also for a lot of us, the pandemic really honed in our need to really take care of ourselves and really focus on our baseline health before we even start talking about sickness. But listen, I know everybody's listening, want to know what the heck is skin cycling. Enough of this. Tell us. Everybody's eager. So let's start there. And I do want to hopefully have time to go back to a lot of your expertise in social media and being an entrepreneur. I mean, I think it's fascinating points, but really, tell us, Whitney, what is skin cycling?
Skin cycling is my customizable strategic method of cycling through your powerful actives, your exfoliating acids, your retinoids as part of your evening skincare routine in order to really drive results in the skin but minimize irritation. So it takes a smarter, not more approach to skincare by pushing skin outside its comfort zone on certain nights of the week, by really introducing those powerful, potent actives, but then also building in what I call recovery nights, which are nights when you're just focusing on hydration, repairing the skin barrier, rebalancing the skin microbiome. And so it really was inspired by my deep working knowledge of skin biology, skin histology, ingredient mechanism of action. I mean, essentially, skin cycling is coaching and conditioning the skin to behave in a more optimized and youthful way by taking into account how each ingredient speaks to the skin, either through binding to receptors or creating cascades of cellular signals that are going to actually alter the cellular milieu within the skin. So I'll just talk you through a classic skin cycling program. The classic skin cycling program, which is the one that really went like mega viral, this is the one with 3.5 billion views, just went international. There were dermatologists, estheticians in so many different languages, so many different countries talking about skin cycling. A lot of them were referring to the classic skin cycling program, which is a 4-night cycle. So it starts with exfoliation night. So exfoliation night is the night when I recommend using a leave-on exfoliating product, ideally that has a blend of alpha hydroxy acids, polyhydroxy acids, beta hydroxy acids. And essentially that's going to dissolve away the uppermost layer of the skin. So overnight, you're going to get that healthy glow, but it's also going to prep the skin and prime the skin to get the most out of night 2 of skin cycling, which is retinoid night. So, as you guys know, retinoids are one of those powerful ingredients in all of skincare, right? And they're going to speed skin cell turnover. Within a few days of starting a retinoid, you're going to notice smoother, softer skin. But if you consistently use one over time, it can actually, really help to firm the skin, smooth out lines, wrinkles, etc. So, but a lot of people can't tolerate retinoids every single night, right? So, on night
Right.
two, I like to focus on retinoid night. And then if you go into the classic skin cycling program, which is the one that most people who have sensitive skin, mature skin, dry skin tend to gravitate towards, then nights 3 and 4 are recovery nights, where you're deliberately avoiding any potentially irritating ingredients and you're just focusing on repairing the skin barrier. So you're just focusing on things like ceramide, squalane, hyaluronic acid, prebiotics, postbiotics, finding like serums, creams that are really going to repair the skin barrier and just rebalance the skin microbiome. And in the classic skin cycling program, you then cycle back to night one. So it's exfoliation night, retinoid night, recovery night, and then you repeat back to exfoliation night. But the beauty of skin cycling is that it really is customizable. Like it's not one size fits all. So it's meant to be a flexible framework that you can flex up or flex down based on your skin's needs and your skin's goals. So for example, I have a lot of patients who graduate to an advanced skin cycling program. They're fine, they're thriving, their skin is doing great. On the classic program, they're like, Dr. Bowe, I want to get more out of these actives. Like, I think my skin can tolerate more. I want to really tackle some of the texture, some of the dark spots. And then we basically graduate them to an advanced skin cycling program. And the concept there is that you're building in more consecutive retinoid nights and you're dropping recovery nights. So, for example, it can look like this: exfoliation night, retinoid night, retinoid night, retinoid night, recovery night, and then cycle back to exfoliation night. And a lot of my patients who have more oily, acne prone skin, they'll do much better on an advanced skin cycling program where they're using more and more retinoid nights and their skin really thrives there. But then on the flip side of things, I have patients who, and I know you guys have a lot of these patients with eczema, patients with rosacea, patients with really sensitive skin, that their skin barrier is already so vulnerable, so compromised, and they actually thrive on what I call a gentle skin cycling program, where they're using exfoliation night, retinoid night, recovery night, recovery night, recovery night, and then they cycle back to exfoliation night. So this is really for most of the people that I'm talking to here are people who are not actively struggling with an active skin condition. They're sort of looking more to optimize their health. A lot of my patients are looking for that radiant, glowing skin. They want to do the most that they can. A lot of them are perimenopausal, menopausal. They're starting to see, changes in their skin from an aging perspective. They want to optimize their skin health and they're looking to do everything that they can. So when people come to me and they say, "Oh, I have a specific, skincare condition," I always say to them, "Well, talk to your dermatologist first because the most important thing is for you to be on a consistent regimen that your dermatologist approves of, and you always want to focus on the prescriptions and the program that your dermatologist prescribes for you, and then when your skin starts to really thrive and you're in more of a stable and steady state, then you can start thinking about something like skin cycling. But if somebody's got an active skin condition or they don't know the diagnosis, like, oh, they're breaking out, they're not sure what it like, don't stay home and start skin cycling, for goodness sake. Please go see an expert, get diagnosed. But yeah, but skin cycling has worked for so many. It's really intuitive, right? Like your
Right.
muscles need recovery, your mind needs
Exactly.
recovery, right? So it makes sense that your skin also benefits from recovery.
This is such a brilliant concept to just cycle and have that flexibility with ingredients and being able to customize it, however you see fit, but to have some basic guidelines. I think that's brilliant, Whitney. What would you say for people that really do have a tough time with retinoids altogether? Are there any suitable alternatives? Can you talk about your opinion on, say, like a bakuchiol or other options between the retinols? What would you say to those folks that say, hey, this is really tough? And then can you also add on, do they need to be prescription strength retinoids? What's your opinion on that too?
I love this question. So, first of all, let's start with retinoids themselves, then we'll go to retinoid alternatives. But when I think about retinoids, first of all, I think this is a topic that even dermatologists dermatologists find very confusing. So when I'm talking to people on social media or talking on television about retinoids, I like to talk about retinoids the way I talk about caffeine and your morning caffeine. So, first I start with saying, like, if you, a lot of people have heard of retinol with an OL, right? So I like to think of retinol the way I think about my morning cup of joe, my morning cup of drip coffee, right? It's tried and true. It's going to do the trick for many people, but there's a newer ingredient that a lot of people are very excited about called retinal, which you guys are very familiar with, which I like to talk about in terms of maybe like a double shot of espresso, right? Because it's 10 times more bioavailable than retinol. So you can get, it's going to be able to go to work more quickly, more efficiently in the skin. The skin has to do less gymnastics, to actually get it to go to work. And then when you think about your prescription strength, which is going to be like your tretinoin, your Tazarac, your Retin-A, I think about that like getting an IV drip of caffeine going straight into the vein. Like it's going to be the most potent form, right? But a lot of people just can't tolerate those prescription retinoids. And, I like to try to explain, I think it also depends on what that person's coming to see me with. So if somebody's coming to me because they're concerned about age-related changes in the skin, then I explain to them, irritation doesn't necessarily correlate with efficacy. Like you don't want to push your skin so hard with a retinoid that your skin can't tolerate that you're living with this, irritation, inflammation. Like that's actually going to be counterproductive to your reaching your goals, right? So maybe instead of using tretinoin, maybe you do want to use an over-the-counter retinal, right? As opposed to if somebody comes to me and they have, scarring acne or acne that's leading to hyperpigmentation. If we look at those studies, then irritation is actually correlated with a greater benefit, more efficacy, faster results, right? So in those cases, then sometimes it is worth, living with that irritation, living with that discomfort, pushing those prescription medications, if you can tolerate them. And of course, talking about other things as well, such as oral medications and taking a very multi-pronged approach to really treating that acne and getting it under control, whether it's hormonal, Accutane, etc. I think that retinoids in general, like it's just something to be aware of. I think a lot of people think that they need to go to the prescription to get the efficacy in terms of the age-related benefits, and that's actually not the case. And we know that, and you guys have done beautiful studies specifically looking at that. So that's my take when it comes to the retinoid family. But I think in terms of sort of retinoid alternatives, I haven't been blown away by the natural botanical alternatives to retinoids that are still supposedly within that class. I think I've been a little bit more excited by the category of peptides and just looking at how certain peptides and certain blends of peptides, can actually lead to this, cellular cascade that can communicate with the deeper layers of the skin, specifically the fibroblasts, and actually stimulate elastin, collagen synthesis, hyaluronic acid synthesis, and can actually, change the quality of the skin over time, like crepey skin, cigarette paper skin. So, not all peptides are created equal, and some have a lot more science behind them. But, when patients come to me and they say, like, I can't tolerate a retinoid, I really can, and I've tried a million different ones, and, whether I'm using retinol, retinal, tretinoin, like nothing, my skin just doesn't tolerate it at all, or maybe my skin only tolerates it once a week, and I'm on this, I really want to do something more in terms of firming the skin and firming the texture. I often guide them towards, peptide containing products instead.
Wow, Whitney, that's awesome. So much to say. I got to say, first of all, thank you for putting this word cycling to help me at least. I know I always thought about it, always thought, I think I termed it to my patient minimally effective dose, trying to get, just do as much as you can, give your skin a break. We all say that, but putting in this kind of beautiful terminology makes a lot of sense. There's carb cycling, there's muscle relaxation time with exercise. There's so many concepts in biology that are similar, and it makes a lot of sense for people. So cycling make a lot of sense. And I love the fact that it's almost product agnostic. You can pick the ones that you like. You can do it on your own or with some guidance from a healthcare professional. And I wanted to ask you about that because I'm trying to think, how am I going to do this for my patients, right? And it sounds to me like almost you need a personal trainer, right? It's like exercise cycling, right? So you get some time off and then you meet your personal trainer to, oh, you're doing good. Okay, let's adjust this, let's fix that. But In the reality of managed care now, if we really want to put it in that context, I get to see patients like every 4 to 6 months, maybe, because you got to open spots, you got to get patients in. People are waiting, they're suffering. You want to get them to treatment. How can the average dermatologist really incorporate that into their recommendation style when they can't see patients? Maybe they can. Tell us, how do you suggest dermatologists incorporate this system into their practice?
Yeah, I think that it's such a hurdle, right? Just in terms of like the way that our system is set up, that so many dermatologists are put in positions where they have to see so many patients so quickly. So, one of the things that I try to do is on my website provide these resources where you can actually like read blogs, like how to get started on skin cycling, how to cycle if you have acne or oily prone skin, how to skin cycle if you have sensitive skin. So, oftentimes for me, even in my practice where I love talking about this, but again, there's only so much time, right? So I do refer a lot of my patients, just to those resources, just so that they can, read the different blogs, see the different infographics, sort of visually see the different cycles. Like once you see the gentle skin cycling and the classic and the advanced, and it really becomes very intuitive for people. Like once they sort of see that, just the way that it's set up, that framework, and then they understand that it's not one size fits all. It's not, oh, I'm doing it right, I'm doing it wrong. It's really about listening to your skin. It's about like learning that if your skin feels irritated, like say you overdid it, with your exfoliating product. Say you were, oh yeah, I love an exfoliating product I'm using, but now my skin feels like it's stinging, it's burning, it's red, it's blotchy. Like I think I overdid it. Then knowing to build in more of those recovery nights, knowing like, okay, wait, I'm going to hit pause. I'm going to keep, repeating recovery nights and not dive back in with my exfoliating product and not dive in with my retinoid. I think that people will be able to, once you start doing it, it's much less complicated because it becomes very intuitive. And I think what you said before, it's skin cycling wasn't a completely novel concept in that we as dermatologists have been educating about this forever, right? But we would say it in a different way. We would say it in a more linear way. We would say
Right.
things like, exfoliating is great. Oh, but you don't want to exfoliate every night because that can be really irritating. Retinoids are really great, but you don't want to use a retinoid every night if your skin can't tolerate it because you can also get like, red and stinging and burning and retinoid dermatitis, and that's not good either. And oh, you may not want to use your exfoliating product on the same night as the retinoid because that can really irritate your skin. So we were saying all the right things. We just didn't say them in a way that sort of gave people that aha moment the way that skin cycling did. Like once they saw that cycle, once they actually see, the just the framework of like, oh, you're going exfoliation night, retinoid night, recovery night, and then cycle back, and you can sort of tweak it and go up and go down. But once we gave them that flexible framework, they all of a sudden were able to implement all that advice that we've been giving forever, but it just seemed much more accessible. It just seemed easier for people to start using. I also find that estheticians love talking about skin cycling. Like if I don't have time in the office, I will often refer to estheticians who I feel like they immediately were one of the first group of experts to sort of jump on the skin cycling program and talk about how they personally customize it for their clients. They have more time, individually one on one in the treatment room with their clients, and their clients do come to them with this expectation that they're going to walk away with more of a skincare program, a skincare regimen. So sometimes just having like one or two estheticians, which you can either have in your practice or you might be able to refer to in your neighborhood, who are familiar with the topic and the concept, and they can really help customize that program, with that patient. That's also has been a win-win for me, just in terms of like time saving.
Yeah, very useful tips. And for those of you who are listening, it's probably going to be in the episode description. But just in case, the website, well, it's easy. Just Google drwhitneybowbeauty.com. That's the website, right?
Yes, yes. It's skin scribbles because my handwriting is atrocious. So I just wrote all these educational blogs there. So it's like the resources part of it instead of the shopping part. It's more just the education, right? Because I mean, a big
Amazing.
part of what I do is just educating.
I love that you
Absolutely.
also talk about working with the estheticians because I think they really do pride themselves on walking through ingredients and customizing a program. And you nailed it. They do have more time, And I think the people that go visit them really do expect to have a regimen, and this is like a great way of building a regimen. So
Yeah, and I
I think
think
it's a good
doctors
point.
just feel uncomfortable selling products too. Like, I think that it just crosses a
True.
line for a lot of doctors, where they're like,
True.
wait, that's not my role, right? Whereas I think estheticians are more comfortable with that. Like, they're more comfortable with, I think clients come in expecting to walk away with a bag of products. And so I think it just, sets up for just a more comfortable like discussion, for estheticians as well.
Now, Whitney, you talked about exfoliation night or exfoliation day, retinoid day, recovery day. Woo, first of all, I got to say, there's got to be clubs around the country now doing, oh my God, we all get together, we do exfoliation night, woohoo! But,
Hadar,
but
we know you're the founder of the Miami one. Don't act like you don't do it, my friend.
okay, you can find me on the Black Net. Listen, can you break this down for us? Is there a morning and evening, afternoon kind of breakdown to this, or just one time a day?
Such a great question. So cycling is really for the evening, right? So in the morning, consistency is key, in my opinion, because your morning skincare routine should really be all about protecting your skin from the environmental stressors that you will inevitably encounter throughout the day that can potentially trigger free radical damage and oxidative stress. So in the morning, I don't recommend cycling, but rather I recommend just sticking to, and it doesn't have to be a 10 or 12 step skincare routine. So typically in the morning, I say start with a cleanser, ideally one that's not going to strip the skin barrier. And you just don't want to get used to that feeling of feeling like squeaky clean, tight and dry. So a cleanser should leave your skin feeling moist and hydrated and clean, but it should never feel squeaky clean. So I personally like a rich, creamy cleanser because I have dry, mature, sensitive skin. For my patients who have more oily, acne prone skin, I usually recommend a gel based cleanser and ideally even one that has salicylic acid in it. So after that cleansing step, I recommend patting dry and then applying a stable, clinically proven vitamin C antioxidant serum to the face, neck, and chest because we know that's going to protect against free radical damage. It's going to boost the efficacy of your sunscreen, right? So that's going to be step two. And then the next step is to put on your moisturizer. And I always say look for, a moisturizer that ideally is clinically proven to repair the skin barrier and one that's going to dive into the skin, not be too heavy, too occlusive, ideally non-comedogenic, ideally one that's been designed to layer effectively with your other skincare, products and even serve as the perfect canvas for makeup for women who like to wear foundation. And then I say step out of the bathroom, give those first couple layers a chance to dive into the skin, get dressed, come back in, put on your sunscreen, face, neck, and chest, and then put on some kind of a lip treatment. I think so many people neglect their lips. Our lip tissue is especially vulnerable. It doesn't have that same protective barrier compared to the rest of our face, right? So it's even more prone to, just that dryness, chapping, dehydration, and free radicals and oxidative stress from environmental, like just pollution, sun exposure that can accelerate the aging process on and around the lips. I do a lot of cosmetic procedures, aesthetic procedures in my office, and the lip area and the mouth area is one of the first to really show those signs of aging along with the eye area. So, I always say then put something on your lips and, ideally without, something that's going to taste too good, that, anything that's tingly and minty, is oftentimes not going to, be doing your lips a favor in the long term. And then head out. So the morning routine can be very, very simple, but very effective.
Thank you, Whitney. This is awesome because I love what you said about it doesn't need to be 10 steps. How much time do you tell your patients to kind of do this? How long does it take? Because I'm starting here to think, okay, most of my guys, they're listening to this like, okay, I'll do one, I'll do two. But if I'm like 15 minutes in the bathroom just before I even get out of the bathroom, how do you negotiate those patients?
So typically, this should take less than 5 minutes. It actually
Agreed. Wonderful.
probably takes me longer to
The
explain
magic
it than
time.
if you actually do it. Yeah, no, I mean, what did we just say? We just said cleanse, vitamin C, moisturizer, sunscreen, and like a lip balm. I mean, it's
Yes.
5 steps, right? It's not like a million steps. So I think it's pretty streamlined. I do think for men or for teens, combining the sunscreen and moisturizer into one product is probably going to be a little bit more efficient, a little bit more, just something that they can jump into and sort of wrap their heads around. And so long as you're using, enough product to get the SPF on the bottle, I think that that's fine. I think some of my female patients, struggle because they're looking to their foundation, their color cosmetic. They're like, oh, I use makeup, so I'm going to get my SPF from my makeup. And unfortunately, when you think about like using the two finger lengths full of your product to get the SPF on the bottle, if you think about how much foundation that is, that's going to be a really thick layer of makeup that is going to look a little insane for women. So I say try to get your SPF from your makeup, but rather from an actual like sunscreen product that you're applying before. If your makeup happens to have SPF in it as well, wonderful. It's icing on the cake, but I certainly wouldn't rely on that for my sunscreen and sun protection.
Yeah, that's very clever. I actually have not thought about it like that. So thank you for that. Hey, listen, Whitney, this is like a tour de force. I'm so excited. I'm like, I want to jump right now to the bathroom and start working on my skin and start cycling right now. But before I do this, I think we owe our audience one last question, if you don't mind. And I want to go back to the beginning and maybe some tips for the young dermatologist who's now maybe in residency and thinking about how do I start doing my own thing? How can I listen to my own voice inside? Because for you, it's been a process, but I remember you. I remember you as a resident, actually. We come from the same institution, and you always had that strong voice that, you were talking about, and you could see that you were very passionate and focused about what you were going to do. What do you tell these residents who are sitting now in training, or even estheticians who are now in training, and any skin professionals who may be listening? What is that core thing that kept you going that made you say, I can do this? Or what kind of tip would you give them on their way to success?
A couple things. So, first of all, thank you. It's such a huge compliment coming from you, especially. But I think one thing is that, just because something has been done a certain way again and again and again doesn't mean that that's actually the best way, right? So, when I was in training, we were taught that, if a patient came and presented that what they were eating was affecting their skin, we were to debunk that as myth and basically hand them a prescription. Like my textbooks, my professors, I mean, I trained at University of Pennsylvania for medical school, and I trained under Albert Kligman and giants who basically said that diet had no impact on the skin, right? And so, here I was sort of experiencing something else from a personal perspective, hearing something else from my patients. And I really did go off the beaten path. And I published, a very controversial paper of the time called Diet and Acne. And, and really did sort of stand up for a different set of beliefs. And luckily, like a lot of other experts, followed suit. And we had a lot of evidence sort of coming, to the surface at that time, and we were able to sort of shift things and revise the websites and revise the textbooks. And I was awarded a presidential citation from the American Academy of Dermatology for my contribution in that field. So I do think that sometimes like listening to your gut and saying, if you're really sort of experiencing something that's different from the way that it's been done and the way that it's been taught, I think that it's important to listen to that and to try to pursue it, but in a rigorous way, not just get out there and start talking about your hunch. But I mean, I did the research. I really did take that deep dive, and I think if you believe in something, you're motivated and passionate enough to do it. So trust that instinct, but then put in the work to back it, as opposed to just coming out and saying something that doesn't have the evidence behind it, because then you're just, who knows, you may be leading people astray. But I think the other really important tip that I wish I had learned earlier in my life was to prioritize some form of unplugging into your day. So for me, I start off my day with some form of like physical exercise that oftentimes fully engages my mind and my body so that I'm completely in the moment and just focused on my breath and focused on that activity. And actually I cycle through my morning exercise routine the same way I cycle through my skincare, but some mornings that's going to be yoga, some mornings that's Pilates, some mornings that's playing tennis, and some mornings that's running. Some mornings it's stretching, some morning it's weight training, but like whatever I'm doing, I start my day with something that feels like I'm fully engaging my mind, my body, I'm moving my body, my heart is beating, and I feel like I'm filling up my cup, right? I'm doing something that's really just for me, that's making me stronger, making me feel more powerful, and completely unplugging where I'm completely in the moment. And then I'm able to face the rest of my day with such an enhanced clarity and purpose and patience as a mother, as a doctor, as a brand founder. I think that at first that felt very vain. It felt very selfish to do that. Like, oh gosh, how can I take the time? I'm the mother of a small child, or I have so much to do. I can't carve out 45 minutes or an hour, to do something like Pilates in the morning. And I wish that I could tell my younger self, like, actually, it's going to make you better at every other aspect of your day, right? You're going to be better at everything else if you do take care of that need, first thing in the morning, and do treat yourself with that kind of love and that kind of respect. I'm just sort of giving everyone permission to carve out that time, whatever that looks like
Amazing.
for you, but some way to unplug.
Whitney, this is very, even deeply philosophical, this whole approach to life that you're taking. And I mean, the skin cycling thing, this comes up to like life cycling. What's the meaning of longevity? What does it mean to live well, play well, and also treat your skin well? So, we could go on and on, but I have to say it's been an absolute pleasure to have you as part of our podcast. And I just want to remind everybody that, again, she's the founder of Dr. Whitney Bowe Beauty, and there is going to be a special code. The code's going to be LearnSkin15. That'll be active for 2 weeks so that you can get in on the good stuff that she's bringing to all of us. Whitney, thank you so much again, and we really appreciate all your insights and your expertise today.
Thank you so much. Such an honor to be here, you guys.
Thank you for tuning in to the Learn Skin podcast. We hope you enjoyed today's episode and found valuable insights to take away with you.
And before you go, we'd love to ask for your support in helping us reach even more listeners just like you. Leaving a review on your favorite podcast platform not only helps us improve, but it also boosts our visibility and helps others discover our show.
So, if you found this episode helpful, inspiring, or thought-provoking, please take a moment to leave a review and share your thoughts. Your feedback means the world to us, and it truly helps us grow.
Thank you again for being a part of this journey with us. And until next time, stay curious.